Quality improvement through effective teamwork. Hello, everyone. Thank you for joining today's professional development session. The focus of this presentation is to explore how effective teamwork influences quality outcomes in healthcare. We'll look closely at what defines a high-performing team, how collaboration drives measurable improvement, and how leaders and staff across disciplines can strengthen communication, trust, and accountability. In healthcare, our greatest strength lies in our people. Each team member, whether a nurse, physician, social worker, or administrator, plays a vital role in ensuring patient safety and service excellence. Today's discussion will demonstrate how collaboration transforms good intentions into lasting, memorable change. Quality improvement is not a solo effort. It's a team-driven process. Every improvement initiative, from reducing infection rates to improving patient discharge times, requires coordinated teamwork. For example, when a hospital implemented a falls prevention program, success depended on daily cooperation between nurses, environmental services, and maintenance. Nurses monitored patient mobility. Environmental staff ensured flooring was dry and clutter-free. Maintenance teams repaired loose rails immediately. According to McLaughlin and Kaluzny, teamwork fostered shared responsibility for quality. Interdisciplinary groups bring varied expertise, clinical, operational, and administrative, to examine problems from multiple perspectives. This collective intelligence ensures that solutions are comprehensive rather than narrow. When teams are empowered to use data, review outcomes, and make decisions collaboratively, they not only improve quality, but also build a stronger organizational culture grounded in trust and accountability. High-performing teams exhibit 5 essential qualities: shared vision, mutual respect, clear roles, open communication, and outcome-driven focus. These elements distinguish a group of individuals from a truly coordinated unit. Consider an emergency department quality team that used real-time dashboards to monitor patient data. By reviewing daily metrics together, which include triage times, lab turnaround, and patient satisfaction, they could identify workflow bottlenecks and adjust staffing needs accordingly. McLaughlin and Kaluzny describe these teams as self-reflective systems that continuously learn. They applied structured tools such as Plan, Do, Study, Act cycles, otherwise known as PDSA cycles, root cause analyses, and control charts to guide their work. These tools give structure to teamwork and convert observations into evidence-based action. When team members recognize how their individual responsibilities connect to their organization's broader mission, such as safety, equity, or efficiency, their motivation and engagement increases. A high-performing team is therefore not defined only by skill, but by purpose, process, and unity. The effectiveness of any team depends on the clarity of its internal processes and the understanding of individual roles. Leadership, delegation, communication, and accountability all shape these outcomes. Strong leadership ensures focus and consistency while ensuring balanced authority with empowerment, which encourages staff input while maintaining direction. For instance, a charge nurse who invites suggestions during shift huddles creates an environment where innovation thrives. Clear delegation helps prevent duplication and confusion. Each member should know both what they are responsible for and why it matters. One example could be how medical assistants can be trained to reconcile medications during check-ins, which would free providers to focus on clinical discussions, and overall a clinic could see fewer prescription errors and improved patient safety. However, poor delegation or unclear communication can lead to wasted time and errors. Regular debriefings, shared documentation systems, and transparent workflows keep the team synchronized. Ongoing education is equally critical. McLaughlin and Kaluzny emphasize that continuous training strengthens both competence and confidence. Whether learning a new electronic health record module or adapting a new quality metric tool, professional development keeps teams agile and aligned. Cross-functional collaboration is the heartbeat of high-quality care. A single patient's journey often involves dozens of professionals: physicians, pharmacists, nurses, case managers, therapists, and billing specialists, all working towards the same outcome, which is safe, efficient, and compassionate care. Still, interdisciplinary work can invite conflict. A physician may prioritize clinical accuracy, while an administrator focuses on resource allocation. A pharmacist may disagree with a nurse over medication timing. Such tensions are normal and, when managed correctly, can lead to better outcomes. To mitigate these conflicts, teams should establish structured communication pathways, weekly interdisciplinary rounds, data dashboards visible to all, and shared performance goals. As McLaughlin and Kaluzny note, when teams align their objectives around patient outcomes rather than departmental priorities, cooperation replaces competition. Conflict and change are inevitable, especially in complex systems like healthcare. What distinguishes a successful team is not the absence of conflict, but its management. Change, whether implementing a new documentation system or shifting care models, often brings staff anxiety or resistance through fear of losing autonomy or competence. Leaders should recognize the resistance as a natural reaction and address it through empathy, clarity, and engagement. For example, if a behavioral health clinic were to transition to a new electronic record system, including leadership as well as frontline staff in the testing phases and feedback sessions, would overall reduce frustration and help build project ownership. McLaughlin and Kaluzny highlight that transparency, education, and two-way communication are the most effective tools for navigating change. By explaining the rationale behind changes, providing training, and celebrating incremental success, leaders can transform resistance into enthusiasm. When teams openly discuss conflict, they learn from it. Constructive disagreement sparks creativity and leads to better decision making. Silence, on the other hand, allows problems to fester, and effective teams should view conflict as a source of growth, not division. Even the most capable teams need support. Sustained high performance requires an infrastructure that values teamwork, communication, and recognition. Organizational support can take many forms. Tangible resources could look like ensuring adequate staffing, modern technology, and access to data. Intangible resources could be staff recognition, emotional support, and leadership visibility. McLaughlin and Kaluzny point out that celebrating small wins maintains momentum and prevents burnout. Rewards don't always have to be financial. Sometimes public recognition, leadership praise, or professional growth opportunities are just as effective. Team culture also plays a major role. When communication is open and psychological safety is protected, employees are more likely to speak up about errors, propose solutions, and engage in peer learning. A supportive culture combined with clear metrics, training opportunities, and shared accountability ensures that teams not only meet but sustain quality standards over time. To summarize, effective teamwork is the foundation of every quality improvement effort. High-performing teams integrate communication, data, and collaboration to create safer, more efficient systems of care. By embracing cross-functional collaboration, teams bring diverse perspectives that spark innovation and ensure comprehensive solutions. When conflicts arise, they are managed through respect, evidence, and open dialogue. When change occurs, it is guided by leadership that values inclusion and shared purpose. As McLaughlin and Kaluzny remind us, continuous quality improvement is not a one-time event. It's an ongoing journey shaped by people who care deeply about their work and their patients. Our challenge and opportunity as professionals is to continue investing in our teams throughout learning, support, and collaboration. When we work together towards shared goals, we not only improve the quality of care, but also enrich our workplace culture, our professional growth, and the well-being of those we serve. Thank you for your dedication to teamwork and to delivering exceptional quality care every day.